Hello all, today we can see about the topic anemia. What is anemia? Anemia happens when the number of healthy red blood cells in body is too low. RBC cells carry oxygen to all of the body's tissue, so a low RBC count indicates the amount of oxygen in blood is lower than it should be. Many of the symptoms of anemia are caused by decreased oxygen delivery to the body's vital tissues and organs. Anemia is measured according to the amount of hemoglobin, the protein within RBC that carries oxygen from the lungs to the body's tissues. Anemia affects more than 1.6 billion people, trusted sources around the world. Women and people with chronic disease such as cancer have the higher risk of developing anemia. What causes anemia? Dietary anemia is caused by dietary iron. Then vitamin B12 and folate are essential for RBC cells to mature in the body. Normally 0.8 to 1% of body RBC cells are replaced every day, and the average lifespan for RBC cell is 100 to 120 days. Any process that has a negative effect on its balance between RBC cells production and destruction can cause anemia. Causes of anemia are generally divided into those that decrease RBC production and those that increases the RBC destruction. Factors that decreasing RBC cell productions are the things that typically decrease the red blood cells production causing anemia include inadequate stimulation of RBC production by the hormone erythropoietin, which is produced by the kidneys, inadequate dietary intake of iron, vitamin B12 or folate, hypothyroidism. Factors on increasing RBC destructions are, on the other hand, the disorders that destroy the RBC cells at the rate faster than they are made can cause anemia. This typically occurs due to hemorrhaging, which can happen because of endometriosis, accidents, gastrointestinal lesions, menstruation, childbirth, excessive uterine bleeding, surgery, cirrhosis, which involves scarring of liver, fibrosis, the scar tissues within the bone marrow, hemolysis, a rupture of red blood cells that can occur with some medications or RH incompatibility, disorder of liver and spleen, genetic disorders such as glucose 6 phosphate dehydrogenase deficiency, thalassemia, sickle cell anemia. Overall, however, iron deficiency is the most common cause of anemia. It accounts for nearly half of all anemia causes and is a major nutritional disorder worldwide. Types. There are many different types of anemia because there are so many different causes. The causes can be divided into three main groups: increasing red cells destruction, decreased red cell formation, and blood loss. Types include aplastic anemia, anemia due to blood loss, anemia of chronic disease, folate deficiency anemia, diamond blackfan anemia, hemolytic anemia, iron deficiency anemia, Fanconi anemia, thalassemia, anemia due to glucose 6 phosphate dehydrogenase deficiency, hereditary spherocytosis, autoimmune hemolytic anemia, microangiopathic hemolytic anemia, pernicious anemia, sickle cell anemia. Some types of anemia are mild, short-lived and easily treated, while others are severe, long-lasting and life-threatening if not diagnosed and treated. Some forms can be prevented with a healthy diet and other forms require treatment with supplements or transfusions. What are the symptoms of anemia? People with anemia appear pale and may often complain of being cold. They may also experience lightheadedness or dizziness, especially when overactive or standing up. Unusual cravings such as wanting to eat ice, clay, or dirt. Trouble concentrating or tiredness, constipation. Some type of anemia can cause inflammation of the tongue, resulting in the smooth, glossy red and often painful tongue. If anemia is severe, fainting may occur. Other symptoms include brittle nails, shortness of breath, chest pain. Blood oxygen levels can be so low that a person with severe anemia can have a heart attack. If you get physical exam and have anemia, results may show higher or low blood pressure, pale skin, jaundice, and increased heart rate, a heart murmur, enlarged lymph nodes, and enlarged spleen or liver, atrophic glossitis of tongue, absence of floriform or fungiform papillae on dorsal surface of tongue. People with signs of Signs or symptoms of anemia should seek medical attention, especially if fainting or chest pains occur. How is anemia diagnosed? A diagnosis of anemia begins with both health history and family history. Physical exam. A family history of certain type of anemia such as sickle cell anemia can be helpful. A history of exposure to toxic agents in the home or workplace might point to an environmental causes. Laboratory tests are often what's used to help doctors to find out the causes of anemia. Tests to diagnose anemia include complete blood count, serum iron levels, ferritin test, vitamin B12 test, folic acid test, stool test for occluded blood. Additional tests are an upper GI, a barium minima, chest X-ray, a CT scan of abdomen. Treatment. The range of treatment for anemia each aims to increases the number of RBC, which in turn increases the amount of oxygen in the blood. Below we outline treatment for several types of anemia include iron deficiency anemia. Iron supplements and dietary changes can help, and when relevant a doctor will identify and address the cause of excessive bleeding. Vitamin deficiency anemia treatments can include dietary supplements and vitamin B12 shots. Thalassemia treatments include folic acid supplements, iron, gelatin, and for some people blood transfusions and bone marrow transplants. Anemia due to chronic disease, the doctor will focus on resolving the underlying causes. Aplastic anemia treatment involve blood transfusions and bone marrow transplantations. Sickle cell anemia treatment typically involve oxygen therapy, pain relief medications, and IV fluids, but it can also include antibiotics, folic acid supplements, blood transfusions, and cancer drugs called hydroxyurea. Hemolytic anemia, the treatment plan may include immunosuppressant drugs, treatments for infections, and plasma morphosis, which filters the blood. Thank you.